Hi, my name is Debbie Komisak. I'm doing the video presentation for the Population Health Sentinel City, the windshield survey of the city. While I walked around the sections of Sentinel City, I found the city to appear like what you would envision a city to look like, probably somewhat of poorer sections of the city, and there were also some more affluent sections of the city, such as like Nightingale Square was more affluent. Demographics showed that the population was 663,862, with the white race being the most prevalent at 80.6%. Blacks were the second most popular or populated citizens at 10.4%, and the least amount of people in the city were Hawaiians and Pacific Islanders at 0.2%. The Acer Tech Center had the most people greater than 65 years of age, and Casper Park District had the greatest number of children 18 and younger at 33%. Incomes varied greatly, with Casper Park being 80,134,000 up to Nightingale Square being 269,550 for household incomes. I noticed also that the poorer section and the more affluent section of Nightingale Square were at opposite sides of the town. I noticed there to be a mixed age range of people on the streets. There were some disabled people noted walking on crutches and in wheelchairs. There were protesters on the corner. I saw a fair amount of police on the sidewalks, and I noticed that there was a church in the city which was interfaith. In the Casper Park section was a resident named Gary Johnson who was homeless. Also, Dwayne Thomas, also homeless with a service dog. They weren't begging, and you wouldn't know they were homeless by walking by them, but they were. Also noted was a prisoner out on work release, Fabio Caraca, and that was in the Casper Park district. By the church, there was a soup kitchen in which the people lined up to get soup. A stray dog was there. Graffiti, an abandoned and stripped car was noted in that area. I did notice that the city offered a playground, and Joe's grocery store was also there, which seemed to sell a variety of products. For my target population, I chose the 18 and younger pediatric population. Relevant data of this population is that most of the peds population reside in the Casper Park district. This is also where the ABC Daycare Center is located, and with that there are mostly for-profit daycares in the city. They also do have some licensed home and family members in home daycares. The Better Health Clinic provides contraceptive service and STD services along with other preventative health services. I noticed that the teen pregnancy ages 15 to 17 rose from 200 to 500 over the last 1 year. Immunizations in Sentinel City are less than the United States percentages as a whole, with the Industrial Heights section ranging in the lowest percentages. Three major concerns of the pediatric population would be teen pregnancy, teen STDs, and childhood immunizations. Sentinel City has an increase in teen pregnancies. I found from my research that globally the leading cause of death in 15 to 19-year-olds is complications from pregnancy and childbirth in that age range, and that was from the World Health Organization Adolescents Health Risks and Solutions. According to the CDC, 20 million new cases of STDs are diagnosed each year in the United States, and half of them are in the age range of 15 to 24-year-olds. It's the hesitancy to talk about sex lives not getting the proper STDs testings due to either not having any transportation or insurance leads to adolescents having an increase in the disease, as does young people having more than one sex partner. And that came from the CDC fact sheet, information for teens and young adults. Not being immunized or under-immunized is another health concern for children. There is a real threat of death and serious illnesses as a consequence for not having your child vaccinated. The decline of immunizing children comes from children in the United States being not immunized because of allergies or religious beliefs, and this is despite the mandation of all children having immunizations to attend school. Unimmunized children have a higher rate of measles, pertussis, which is both preventable by immunizations. These unvaccinated children put other children at risk because of if not enough members of a community are immunized, an immunized child can fall below the immunity threshold, and this in turn would give the organisms a opportunistic infections, and it would reestablish itself to infect even those that are immunized. And that came from the NCBI, Robert Field, author. So those were some of my major health concerns for the pediatric population of Sentinel City. My SMART goals based on the CDC Healthy People 2020 in relation to the major health concerns for the peds population in Sentinel City would be as follows. For adolescent health, I would offer education. My SMART goal would be offer education to teens on safe sex. A counselor will be hired at the Better Health Clinic in 3 months. We would advertise for a counselor in adolescent safe sex education. The adolescents will have a place to be educated on their safe sex practice, and education will be provided 5 days a week. For immunizations and infectious diseases, I would offer education on the risks and benefits of immunizations to the families. An educator would be available to educate families on the benefits of immunizations. I would hire the educator for public health department. For the public health department, families will be educated and encouraged to vaccinate their children, and education and vaccinations will be provided 5 days a week. For maternal, infant, and child health, I would have new mothers will be properly educated on care of newborns. This would cater more to the teenage new mothers. A nurse would be hired to teach new teen mothers proper care of newborn and risks of shaken baby syndrome. Teens will have an understanding of proper newborn expectations and their care. Teens will have a better understanding of the stresses of parenting, and we will see a decrease in child abuse and shaken baby and the stresses of teenage new parenting in 1 year. For family planning, based on the CDC's Healthy People, the teens will have a place to go to learn about teen pregnancy. We will hire an RN to educate the teens on teen pregnancy and the risks and preventions. Teens will be educated on the risks of teen pregnancy. Teens will use safe contraceptives and be provided with them free of cost. And our timeline would be a decrease in teen pregnancies over the next year. And that concludes my video presentation. Thank you.